this is a slightly different demographic. So this was a younger patient in their 40s, and it's quite unusual to have lateral recess stenosis at that age. But it's a good example of what I think is it Jane? Was
Evergreen was
Evergreen. So Evergreen, what you can see on this scan here is that there's facet hypertrophy.
You have to use your tweaker, I'm afraid.
You can see that there is facet and ligamental hypertrophy there.
That's the black.
That's the black
stuff.
And it's squeezing the whole theca. So you've just got a sliver of epidural fat in the middle. That's the limb of the T that's coming down, and all of the nerves in the middle are bunched together there. So you can only just see the CSF space. That's bilateral lateral recess stenosis from hypertrophy ligamentum and facet joints. I think actually this is the CT scan that goes with that. So you can actually see here on the right-hand picture, if I can get this up, that ligamentum was partially calcified as well.
Yes.
So do you see the smaller V in the top of that picture there? That's actually calcium within the ligamentum. And what you can do with this is what I did with this, and this one was I used the endoscope and decompressed both sides. You can see the picture. These are the X-rays. You asked me how I know where to put the instrument.
Yeah.
We'll use X-rays to make sure that you're in the right position. This is a slightly bigger scope than 6 millimeters. This is an 8 millimeter scope. This is the stenosis scope. You can put a bigger drill in with that, and you can see this is the kind of thing that you can achieve. So what we're looking at here is the inside of the spinal canal at that level. The pink thing with blood vessels on the top here is the theca, so the bag that contains the lumbosacral nerve roots. This is the inside of the spinal canal and the base of the spinous process, which has been drilled. So the structural integrity of the spine is still intact, but the bit that was pressing on the theca has been removed. And you're able to get across to the opposite side of the spine and decompress the lateral recess on the contralateral side. So the name that you give to that is an over-the-top decompression, because you go over the top of the spinal canal. And hopefully I included a post-op picture here to show you that you can actually, so this is what you can achieve. Remember the previous picture before? Yes. With that calcified V, that's all removed there. And that space is now free for the nerve roots to go through. So not quite sure what Evergreen's patient's pathology was, but something like that is what I would do. But anything to decompress the nerve would probably improve the leg pain.
Okay.